Hi, I'm Dana J, and this is Henry Ford Health System News. Here at Henry Ford, our team members make the impossible possible. That could be through groundbreaking research or finding ways to help each other through tough times. It always means taking action when someone needs help, which is exactly what 3 team members recently did at a parking garage in Grosse Pointe.
Hi. How are you guys?
The last time these Henry Ford heroes saw Antoinette Coleman, there wasn't time for pleasantries. There was a crisis.
Very welcome. Thank you.
Antoinette had pulled into the parking garage at Pearson Clinic. Her baby, Jaden, who'd been born premature and wears an oxygen monitor, had an appointment. As Antoinette was getting out of the car, the alarm on Jaden's monitor started going off. He wasn't breathing.
I noticed he was, like a rag doll, just stiff and real foaming at the mouth and not responsive.
She grabbed him from his car seat and took off for the stairwell.
I ran with him in one arm and the stroller in the other arm as far as I could to get into the doors to get help.
Eleanor Glover was the screener on duty on the first floor of the clinic that day. She heard something a few floors up that didn't sound right.
A lot of commotion, patting, so I got up to look to see what was going on.
She found Antoinette and Jaden at the top of the stairs.
She just started patting, and then she looked at me and she said, "Go get help." My adrenaline just went to 200 at that point. And I just took off, started running, and ran to the second floor, got to the middle of the floor, and I asked someone, "Please do an overhead page. We have a baby on the 3rd floor Pearson Clinic in the garage that's not breathing."
Registered nurse Kelly Hyde heard the page and came running.
I saw the mom coming at me, holding her baby, just kind of up in her arms like this, saying, he's not breathing very well. And she just kind of succumbed and handed the baby over to me.
Kelly took over for Mom, continuing to pat Jaden on the back, trying to get him to take a breath. Kathy Kokish, a nurse in pediatrics, ran up next and took over.
Kelly said, "Something's coming out," and sure enough, we got a big mucus plug out, and I could feel him moving, I could hear him, I flipped him over, he was doing all the right things.
But when she recognized the patient, she knew she had more to do.
I knew he was a premature, I knew he had some lung issues, I knew we had to do something fast. We couldn't just stand here and watch this baby.
The next call was to a pediatrician and then 911. Jaden spent some time in the hospital, but now he's doing fine. His mom, who's also a nurse at Henry Ford Hospital, wanted to bring him back to meet his heroes and say thank you in person.
They don't get the appreciation they deserve on a daily basis. The empathy that they showed and compassion that they showed, we appreciate.
That was all back in June. Jaden, who had been born premature in March, was only out of the hospital for about 3 weeks at the time. Now he's 5 months old, and as you can see, doing just fine. Now let's go to the Hermelin Brain Tumor Center, where researchers are developing a test called liquid biopsy. It could prove to be a more efficient but less invasive way to monitor and diagnose tumors.
At the Hermelin Brain Tumor Center, our patient donors are contributing to exciting new research in liquid biopsy. In addition to donating tumor tissue, our patients are now donating blood to the tumor bank. Our researchers at Henry Ford are developing a blood-based test called liquid biopsy to diagnose brain cancer, suggest a course of treatment, and monitor tumor progression. Right now, we have to wait for a surgical procedure to biopsy a tumor and make a diagnosis. With liquid biopsy, we can collect a blood sample as soon as we see what resembles a tumor on an MRI scan, and we can use that blood sample to make a diagnosis.
Liquid biopsy can be done anywhere you can get a blood draw. By extracting serum plasma from the blood, we can find the DNA of the patient's tumor. Once you have the tumor DNA of the patient, you can use artificial intelligence to determine the best course of treatment. I believe our research can really improve the quality of life of our patient.
What I think is so cool about liquid biopsy is it's a tool that we can use to understand how a tumor is behaving at a genetic or molecular level as someone is going through treatment in real time, So what that means is we can capture changes in someone's tumor behavior before we see that change on an MRI scan. So we can know if someone's treatment is working right now, and if it's not working, we can change it before the tumor's had a chance to grow and respond to that.
If we can prove this works, this simple approach could be a historic breakthrough in the way we diagnose, treat, and monitor all types of cancer.
I encourage my patients to participate in the liquid biopsy study because I think it truly is groundbreaking research that will change the way we care for patients in the future.
A big thanks to the folks at the Hermelin Brain Tumor Center for having us in their lab and sharing their research with us. Well, we're all stronger when we work together. That's the premise behind Henry Ford's Stronger Together Buddy program. It's one of the programs that's been available to team members to help manage stress over the past year, whether they're working in a hospital, remotely, or somewhere in between. I recently connected with 3 team members who wanted to tell you how the Stronger Together program helped them. I started by asking them what drew them to the program.
COVID hit 2020, and it was just a very difficult time for my team and myself, and I was just looking for some support.
My team and my coworkers, it's like we really connected so well with each other, and we just had to cut that connection off once COVID came. And it was just like the only time we saw each other or spoke to each other, it was always virtually, and we missed that conversation at the lunch table or the coffee pot.
I saw it come across my email, and I was kind of going through a tough time, a lot of transition in my personal life, transitioning in my career. And when I saw the opportunity, I thought, maybe I will talk to someone every day,
Buddies agreed to check in on each other regularly, either by phone, text, or email. You can ask to be paired with someone you know or meet someone new. Prompts from organizers help break the ice.
Me and my buddy, we gelled really well, and instead of communicating weekly, we communicated daily. Every morning, I would send her an inspirational text, or she would send me a workout video. We took it to the limit.
I wasn't uncomfortable or, didn't feel any type of way. I just felt like, hey, you know what? I'm going to meet a new Henry Ford family member.
I'd say if you're looking to be supported, if you're looking to support, if you're looking for an opportunity to do something that you haven't done during a time where change is just happening everywhere, this would be a good avenue to do so, because it's not just a Henry Ford thing. It's a great Henry Ford thing, but it also just allows you to develop almost a skill, really, that you can use in other spaces as well.
Team members can find more information about the Stronger Together Buddy program and other resources for managing mental health on the Recover and Heal page of One Henry. All right, let's do the featured photo. Here's members of our virtual care department picking up an award for outstanding innovation from the Upper Midwest Telehealth Resource Center. Congratulations, and thanks for all your hard work. Don't forget to tell us about the team members you see making the impossible possible. You can email us at newstips@hfhs.org. Thanks for watching, and I'll see you around.